Thank you all for joining us. I'm going to give it just another moment while we have a few more individuals joining from the waiting room. If you would like permission to record, or if you have a question you would like to ask, please indicate so in the chat and I will give you the appropriate permissions or call on you in the order from the chat. So we'll give it just another moment or two and then we can begin, Dr. Vanderhoff. Dr. Vanderhoff, I believe we have all of the permissions to record granted. If anyone else has not yet received permission that needs it, please list so in the chat. And Dr. Vanderhoff, we can go ahead and begin. Thank you, sir.
Very good, thank you. Well, good afternoon. I'm Bruce Vanderhoff, the Chief Medical Officer for the Ohio Department of Health. And I want to express my sincere gratitude for you joining us here today. As of this morning, more than 5.3 million Ohioans have started the COVID-19 vaccination process, and more than 4.7 million are now fully vaccinated. On Saturday, we hit a benchmark we've waited for quite some time. Fewer than 50 cases per 100,000 residents in Ohio. Case rates per 100,000 residents have been monitored throughout the pandemic, and at one point we were as high as more than 900 cases per 100,000 residents, and that was back in mid-December of 2020. Prior to this weekend, the last time Ohio fell below 50 cases per 100,000 residents was almost 1 year ago, on June 25th, 2020, when we hit 49.7 cases per 100,000. And that was for the time period of June 11 through June 24, 2020. On Saturday, June 5th, we reported 49.5 cases per 100,000 residents for the time period of May 22nd to June 4th, 2021. While these are certainly positive signs, the threat of COVID-19 remains. In the public health community, there's concern that if there are low vaccination rates in a particular geography, we could see localized pockets of COVID-19 cases arising. And such pockets could cause a surge of COVID-19 cases, increasing the threat of COVID-19 to the residents of Ohio, along with the possibility of increased hospitalization and deaths, both of which, of course, we want to avoid. When we have such an effective tool to protect ourselves, the COVID-19 vaccines, the risk of going unvaccinated impacts not only those who choose not to be vaccinated, but also those around them. Lower vaccination rates put children under 12, for example, who don't yet have a COVID-19 vaccine authorized for their age group at risk. It also puts at risk the small percentage of Ohioans who can't be vaccinated or those with certain immune disorders. The COVID-19 vaccines have been proven to be highly effective at preventing severe disease, even against the known variants. The bottom line is that the more Ohioans who are vaccinated, the better we can protect ourselves and one another. Sadly, the internet is rife with misinformation, And as this false information spreads, it can cause many to be unduly concerned about receiving the COVID-19 vaccines. The COVID vaccines are not only safe and effective, but absolutely no corners were cut in their development. Let me make three important points in this regard. First, the vaccines can't give you COVID-19. Vaccines don't include any live virus, and thus they can't give you COVID-19. The vaccine works by triggering the immune system to manufacture antibodies against the disease. Secondly, COVID-19 vaccines don't contain other substances or materials that are harmful or controlling. There's a far-fetched notion floating around the internet right now that the vaccines contain microchips or other nefarious ingredients that could be used to control people. These ideas are completely false and simply not based in science or reality. Third, the COVID-19 vaccines simply cannot change your DNA. Some people have misunderstood what mRNA is and how it works, and believe that this approach can somehow alter your DNA, but that's not true. There's no interference with your DNA. The vaccine simply doesn't affect your DNA at all. Finally, we continue to see myths stating that COVID-19 vaccines can harm a pregnancy or impact someone's future fertility. This is also false. The Society for Maternal Fetal Medicine and the American College of Obstetricians and Gynecologists have both recommended that people who are pregnant have access to COVID-19 vaccines. And during the clinical trials, several people actually became pregnant. Now, as reported using the CDC's V-Safe after vaccination health checker, more than 121,000 people vaccinated have indicated that they were pregnant at the time they received the COVID-19 vaccination. After the administration of more than 300 million doses in more than 6 months of national experience, the CDC has not reported any serious vaccine effects on reproductive health. Today, I'm joined by two experts to help discuss fertility as it pertains to the COVID-19 vaccines. First, I'm joined by Dr. Lisa Bowman Egbert, president of the Ohio State Medical Association and vice speaker of the American Medical Association. Dr. Egbert has a solo practice in obstetrics and gynecology in the Dayton area. Dr. Egbert, as I mentioned, there are a lot of myths out there that the COVID-19 vaccines cause infertility, that in particular have women of childbearing age concerned and parents concerned about their children's future fertility. What can you share with people about this concern?
Thank you for that question, Dr. Vanderhoff. And actually, I have to say you've already answered it. Those beliefs are unfounded. There is no scientific evidence, nor is there a scientific pathway for there to be any ill effects towards fertility, both at the time of vaccination and future fertility. And that's what I tell my patients. I'm going to read you ACOG's statement on that. It specifically says, there are unfounded claims linking the COVID-19 vaccines to infertility. They have been scientifically disproven. And ACOG recommends vaccination for all eligible people who may consider a future pregnancy. I don't think it can get any more clear that it is a myth that it will affect your pregnancy. But what it will do is protect you from COVID during pregnancy, which is very scary. There is significant increased morbidity and mortality to both mom and baby if you have COVID during your pregnancy. So I can't stress enough, if you're worried or scared about getting pregnant and getting the vaccine, please don't be scared about the vaccine. Be scared about getting COVID and get the vaccine. Thanks.
Thank you, Dr. Egbert. There have also been social media posts circulating with women reporting changes in their menstrual cycle after vaccination or being around those who've been vaccinated. What are some of the common causes of variation in a woman's menstrual cycle?
So again, that's another one that's a funny myth, because women have variations in their menstrual cycle for all sorts of reasons. And probably one of the most common is stress. So when women are exercising more, athletes, when they are undergoing severe psychological stress, all of those things can impact their cycle. In addition, if you're worried about a vaccine, that might impact your cycle. And for some cases, actually, if you're worried about getting pregnant, darn it, you can affect your cycle. So one of the things that I tell my patients is, please try to relax, not worry about things. Don't let things get you up here, because you can affect your own cycle just by thinking about it. So, and not a cause for concern. There's no direct impact of either receiving the vaccine or being around other people with the vaccine, other than potentially somebody actually worrying about it.
Thank you, Dr. Egbert. I'm also joined today by Dr. Neel Parekh, a urologist specializing in men's fertility at the Cleveland Clinic. Dr. Parekh, women aren't the only patients concerned about their fertility. Men may also be worried about whether the COVID-19 vaccines could have an impact on their future fertility. Can you tell us about whether males can see an impact on their fertility from getting a COVID-19 vaccine?
Thank you, Dr. Vanderhoff. And as you alluded to earlier, just a quick online search, social media search will present a significant amount of misinformation about the COVID-19 vaccine and its effect on male infertility, specifically sperm parameters. So I think right off the bat, it's important for the public to know, just as ACOG has come out with a statement, the two main male fertility organizations in the United States, the SMRU and the SSMR, have come out with a joint statement that states, and I'll read it from them as well: the COVID-19 vaccine should not be withheld from men desiring fertility who met criteria for vaccination. So I think it's very important for the public to know that all of the major organizations in the US support the COVID-19 vaccine. And just as Dr. Egbert had alluded to, is we know that COVID itself can affect sperm parameters and potentially fertility. There was a recent study published that looked at COVID-19's effect on sperm parameters, which was persistent for up to 6 months. So in order to potentially prevent any sort of effect on male fertility, the vaccine is essential. Right now, the CDC is currently performing a clinical trial looking at the effect of the vaccine on two sperm parameters, the concentration and the motility. Now, we don't have the results of that study just yet. We should hopefully have the results by the end of the month. But it is important, and you explained it very well, is how the vaccine works. So we know that the two major vaccines by Pfizer and Moderna use the messenger RNA. And it's important to know that messenger RNA is different than DNA, both physically and chemically. mRNA's role is to basically give instructions to the body to create a protein. So in this case, the spike protein for COVID, and it is not a live virus. The body quickly destroys the mRNA strand and develops an immunity to it. The mRNA does not enter the cell. It does not incorporate it into the genome, so it does not affect the DNA. We do perform there is ways to test DNA damage of the sperm, and we do perform that testing here, sperm DNA fragmentation. What we do know is that certain viruses, illnesses like COVID or the flu, smoking, those in fact can affect the sperm DNA fragmentation of the sperm, which can impair fertility, but not the vaccine.
Thank you very much, Dr. Parekh. Alicia, I think we could go ahead and take questions now if there are any.
Sure. Thank you, Dr. Vanderhoff. Our first question comes from Joe Ingles with Ohio Public Radio and Television.
Hello, thank you for doing this today. I appreciate it. I wanted to ask you, we're hearing another thing that could be a myth as well. We heard it over the weekend when John Rahm tested positive for COVID. Some of the other golfers at the Memorial Tournament were saying, well, we have had COVID, so we have antibodies, and therefore vaccines are not necessary. Can you weigh in on that and give us your thoughts on that, please?
Yeah, I can. So first, there are really two ways that a person can acquire some kind of immunity to COVID-19. One is to get infected. And the net result of that is that you will develop some level of antibody coverage. The other is to get the vaccine. But there's a real whole series of advantages to getting the vaccine over getting infected. First of all, you don't run any of the risks of severe illness, hospitalization, or God forbid, death that you run with getting sick by getting the vaccine. So the vaccine's safer. The second thing that we now know pretty clearly from the medical literature is that the immunity that you would typically develop from full vaccination is just more robust and more long-lasting than what we can reliably predict from natural infection. You know, many people have been observed with natural infection after a period of time to have actually gone on and gotten sick a second time with COVID-19. And we simply don't see that with vaccination. In fact, and you've heard me in the past talk about this on press conferences, there are essentially two kinds of immunity that you develop from the vaccine. One are these antibodies, very important, but even more important is what's known as cellular or adaptive immunity. And this is immunity that can last a very long time and is probably stronger in the face of new variants coming into our communities from other parts of the world. So in a nutshell, no, just relying on having passed COVID is just not as good a protection for anyone as getting vaccinated, which is why we recommend that even people who have had COVID go ahead and get vaccinated. So I don't know if my colleagues would add to that, but that would be my answer.
I will say that I get the same question from many patients who knew that they had it. And I will tell you, I just recently, because this patient was adamant that she did not need to get a vaccine, I said, okay, well, let's test your antibodies. They came back negative. So there you go. Case in point. You know, if we don't know why some infections produce a robust antibody activity and others don't. But clearly they don't all do that. And I suspect, I don't know the story behind the golfer, but I suspect that if he did have it in the past, he's another example of somebody who previously had it and doesn't have enough antibodies to prevent getting it again.
Thank you, doctors. Our next question comes from Caroline Morse with WDTN in Dayton.
Hey everyone, thank you for taking our questions today. My question is asking if the myths that we're hearing all over social media, do you guys think that there are a reason for the vaccine hesitancy or why more half the state remains unvaccinated?
Well, I'll begin. One has to believe that these myths have an impact on some people. You know, we're all consumers of information in this information age, and it's very easy to become confused or misled by some of the information that's out there. We need to see more Ohioans choosing to get vaccinated. It's really important, particularly as we think ahead into the fall and think about the potential for any respiratory virus, including COVID-19, to surge at that time. More people need to get vaccinated. If this set of myths is one of the things holding people back, we want to dispel that. We want to clear these concerns up in people's minds, because none of these issues that we've described should be a reason to hold back on getting a vaccine.
I will agree with that. And I will say, in my personal experience with my patients who are those hesitant, thinking about getting pregnant patients or currently pregnant patients, and they all have their level of hesitancy, but a lot of the reasons that they're hesitant is because of myths that they're reading on social media, or that they're coming in that I heard so-and-so did this, and I'm worried about, my best friend's brother's whatever had, a really terrible reaction. And, it's spreading, like the bad stuff is spreading like wildfire. What I don't understand is why there's not a real fear of a disease that can kill you. And that seems to be less of a fear, right? For some reason, they all know somebody who had it and didn't have a symptom, but they all can name a person who had some awful effect from the vaccine. So I think there is a lot of myth and a lot of bad press. Sorry about the press part, but a lot of bad stuff out there that people just want to believe the bad stuff and don't want to believe the good.
No offense taken. Thank you, doctors.
Yeah, 100% agree with that statement as well. We know that COVID and other febrile illnesses can affect fertility potential, can affect sperm parameters, but there's no evidence with the vaccine. So it just makes no sense for anyone that's looking to get pregnant or interested in maintaining their fertility not to get the vaccine.
Thank you. Our next question comes from Pete Grieve with Spectrum News. Pete?
Hey, I'm wondering about the Johnson vaccine availability in Ohio, because there's been some issues recently. And can you just speak to how many doses roughly are here, or if there's enough, and any sense of when we might be getting more doses?
Well, I can tell you that here in Ohio, we definitely have Johnson & Johnson vaccine available. Our supply is ample. I can't give you the numbers, and perhaps Alicia could track those down for you. But anyone interested in getting the Johnson & Johnson vaccine can. And in many circumstances, when you go onto the vaccine registration websites, they will give you a choice between a variety of vaccines. I know I was just in my grocery store last week, and they had walk-up appointments available for all three vaccines. So I think that the good news is that vaccination of your choice is pretty readily available right now in Ohio.
At our institution, we're offering all three vaccines, for Johnson & Johnson for patients 18 and older, and Moderna and Pfizer for 12 and older.
Thank you, doctors. Our last question that I see in the chat comes from Marty Schladen with Ohio Capital Journal. Marty?
Okay, can you hear me?
Yes, we can.
Okay, thanks. Dr. Vanderhoff, something I see very frequently on social media is that this vaccine is experimental. Would you give some context around that, please?
Yeah, I'd be happy to. There is nothing experimental about the vaccines that we have. They weren't developed overnight, even though they were implemented very, very rapidly. We've had experience with mRNA technology that goes back nearly 2 decades. And this platform, this mRNA model, was under investigation for use in vaccines against influenza and other viruses when we pivoted and focused all of that effort on COVID-19 in an all hands on deck approach to get the best vaccines to Americans as rapidly as possible. All the normal safety steps were taken in the development of these vaccines. Remember, the Pfizer vaccine trial had more than 43,000 participants, and Moderna had more than 30. So as a result, here in America, we're really blessed with having the Cadillac of vaccines, vaccines that are stunningly safe and effective. And they actually were developed over quite a long window. The emergency use authorization process that was used to allow their rapid administration or entry into the marketplace was really just a model that allowed for a much wider distribution than the standard formal FDA quote approval is structured to allow. So it's really more of a regulatory structural question, not an issue of safety or going through all the necessary safety steps. So it's a really good question, and it's really important for us to reiterate that no corners were cut whatsoever in terms of safety in the development or then release of these vaccines.
Thank you, Dr. Vanderhoff. We have one more question that's come in through the chat, specifically as it pertains to Johnson & Johnson compared to the 2 mRNA vaccines, and whether or not some of the previous statements we've made today regarding fertility are also applicable to those who receive the Johnson & Johnson vaccine. Is it safe as well?
I'll give a high level and then turn to my colleagues who are experts in this field. But from a high level, the answer is absolutely yes. This applies to all 3 vaccines in terms of their safety and particularly around issues of fertility. So I will turn it to my colleagues.
So from the female perspective, we have no difference with any of the vaccines, and we are recommending that patients get any of them. There's no increased risk for fertility issues with any of them. And I'll just tell you a personal experience. I personally had Moderna, my son had Pfizer, and my daughter had the J&J, and we all did great. And I'm happy to say none of us have COVID.
Yeah, exactly. Same on the male perspective. All 3 vaccines are very safe, and we recommend all 3 vaccines for all men in their fertility age range. Now, any of the vaccines may cause a slight fever, increase in temperature, but that's nothing that's temporary, and again, is worth the has no effect, long-term effect on sperm potential or fertility.
Dr. Vanderhoff, that was our final question. Is there anything you'd like to add before we conclude today?
Well, I did want to express my particular thanks to Drs. Egbert and Parekh, who took time from their busy clinical schedules to join us here today. They're well-respected leaders in their fields, and I'm very appreciative of their time. And I also want to thank those from the press who joined us today. We really appreciate your interest and your help in getting some of the important health messages regarding vaccination out to the public.
Thank you, Dr. Vanderhoff, and thank you all for joining us today. We will now conclude the meeting. Thank you and have a nice afternoon.